On the Medical Watch for you this afternoon, a weight loss drug war.
Medical reporter Dina Bair has more on a study putting the two most popular to the test.
Lourdes and Ben, we may hear more about Ozempic, but it may not be the most effective choice for weight loss. A study in the Journal of the American Medical Association reveals the results comparing weight loss medications in patients. While patients lost weight on both drugs, tirzepatide, sold under the names Mounjaro or Zepbound, was more beneficial than semaglutide, better known as Ozempic and Wegovy. Patients taking tirzepatide lost nearly 3% more weight in the first 3 months, 4.3% more at 6 months, and nearly 7% more after 1 year. This study did not look at the impact on the heart, but other research has shown some cardiovascular benefits for patients taking these new classes of weight loss drugs. Excess weight puts a strain on the heart, but nearly half of the people in the U.S. do not have access to a heart specialist. The American College of Cardiology is sounding the alarm, reporting 46.3% of counties in America are lacking a cardiologist. Rural and socioeconomically disadvantaged areas are the least likely to have a heart doctor, but people living there are more likely to have heart disease. The average drive to a cardiologist in the U.S. is 16 miles. In counties without a cardiologist, the drive is nearly 90 miles. Experts say they need to find a way to attract physicians to areas in need to mitigate heart disease and early death risk. Vaccines in pregnancy can aid both mother and baby. Weill Cornell medicine researchers say the RSV vaccine is not associated with an increased risk for preterm birth or other poor outcomes. Vaccinating expectant mothers against respiratory syncytial virus, or RSV, does offer protection for newborns who are particularly vulnerable to serious respiratory illness following infection. OBGYNs say the study in pregnant women from multiple populations adds another layer of confidence about the safety of these RSV vaccines for expectant mothers.
Good to know. Thank you, Dina.